Evelyn Parker is 72 years old, a retired office manager from Toledo, Ohio. Every morning at 8 o'clock, she takes her blood pressure pill exactly as prescribed. Her numbers look excellent. Her doctor is satisfied. Her chart looks clean. But Evelyn does not feel well. By noon, she is drained. By late afternoon, she is unsteady. She has stopped taking long walks because she says her legs feel heavy and her head feels cloudy. Twice in 1 month, she stood up too fast and had to grab the kitchen counter to keep from falling. When her son asked what was going on, Evelyn gave the answer millions of older adults give every single day. I guess this is just what getting older feels like. But it was not aging, it was her medication. And when a second physician reviewed not just her blood pressure numbers, but her symptoms, her timing, her other medications, and the way she felt standing versus sitting, one simple change was made. Not surgery, not a new diagnosis, not a long hospital stay, a medication adjustment. Within weeks, Evelyn said something she had not said in over a year. I feel like myself again. I'm Dr. Clara Hoffman. And if you or someone you love takes Amlodipine, Losartan, or Lisinopril, this may be one of the most important conversations you have all year. Let me be very clear from the start. These medications save lives. That is not the debate. The problem is not that they are used. The problem is that in adults over 65, they are too often prescribed, titrated, and monitored as if a 74-year-old body works exactly like a 44-year-old body. It does not. And the side effects that follow are often written off with one lazy explanation. You're just getting older. Today, I'm going to walk you through 6 silent side effects of these medications that are commonly mistaken for normal aging. And I need you to stay with me for all 6, because number 3 is a symptom thousands of people are blaming on allergies. And number 5 is the blood pressure reading that looks beautiful on paper, but can put you on the floor. If you or someone in your family takes blood pressure medication, subscribe right now, because this is the kind of information that changes what happens at the very next doctor's appointment. Before we get into the list, I want to give you a framework for thinking about everything that follows. I call it the symptom substitution trap. It works like this. Pillar 1. Your medication may be doing exactly what it was prescribed to do. It may be lowering your blood pressure. But lowering the number is not the same thing as improving your life. Pillar 2. Once the blood pressure reading improves, many symptoms get mentally reassigned. Fatigue becomes age. Dizziness becomes age. Brain fog becomes age. Swollen ankles become nothing serious. The medication disappears from the conversation. Pillar 3. Older adults process medications differently. Kidney function changes. Fluid balance changes. Nerves respond more slowly. Standing blood pressure matters more. Drug interactions matter more. A dose that looks routine on paper can hit a 78-year-old body very differently than expected. That is the symptom substitution trap. The number improves, so everyone assumes the treatment is fine, even when the person taking it is quietly getting worse. Keep that framework in mind as we go through these 6 side effects. Number 1, the afternoon exhaustion that gets called normal aging. Walter Green is 69 years old, a retired machinist from Grand Rapids, Michigan. He started Lisinopril after a routine visit showed elevated blood pressure. 3 months later, his readings had improved. His doctor was pleased. Walter was not. By 1 in the afternoon, he felt flattened, not sleepy in a normal way, crushed. He stopped doing errands after lunch. He stopped driving long distances. He started turning down invitations because he said he just did not have the energy. His wife thought he might be depressed. Walter thought he was slowing down. What no one asked was this: when did the fatigue begin, and how closely did it track with the medication? Low blood pressure does not always look dramatic. Sometimes it looks like exhaustion. Sometimes it looks like weakness, slower thinking, less stamina, and the strange feeling that your day is over by lunchtime. The National Kidney Foundation notes that ACE inhibitors and ARBs can lower blood pressure too much in some people, causing weakness, dizziness, lightheadedness, and fatigue, especially with position changes. And in older adults, that matters more, because when energy drops, movement drops. When movement drops, strength drops. When strength drops, Independence starts to erode. That is not just aging. That is a symptom pattern that deserves a medication review. If you feel significantly more tired after starting or increasing a blood pressure medication, ask your doctor this question. Could my dose be too much for me at this stage of life? Not too much for the average patient. Too much for you. Number 2, the ankle swelling that keeps getting dismissed because it's harmless. Patricia Nolan is 74, a retired church secretary from Lexington, Kentucky. She had been on Amlodipine for years. Her blood pressure was controlled. But by evening, her socks left deep marks in her skin. Her shoes got tighter, her ankles looked fuller every month. She mentioned it at appointments. The answer was always the same. That's common. Common does not mean harmless. Amlodipine is well known for causing swelling in the ankles and feet. This happens because it relaxes the arteries very effectively, but the veins do not always keep up. Fluid gets pushed out into the surrounding tissue. The result is edema. In younger adults, that may be mostly annoying. In older adults, it becomes functional. It changes how you walk. It changes your balance. It changes your willingness to go out, move around, and stay active. And once activity declines, everything else follows. More stiffness, more weakness, more fear of falling. If you are on Amlodipine and your shoes fit differently by evening than they do in the morning, do not let anyone wave that away without a real discussion. Dose changes help. Combination strategies help. Switching medication classes sometimes helps. The point is this: if the side effect is changing how you live, it is not trivial. If you have had swelling on a blood pressure pill, type swelling in the comments. I want to know how many people were told to ignore it. Number 3, the dry cough that gets blamed on weather, reflux, or allergies. Gerald Whitaker is 71, a retired electrician from Asheville, North Carolina. 2 months after starting Lisinopril, he developed a dry cough. Not a chest cold, not mucus, not an infection. A nagging, relentless tickle in the back of the throat. He tried lozenges. He tried cough syrup. He changed his coffee. He even wondered if it was acid reflux. It was not reflux. It was not pollen. It was lisinopril. ACE inhibitors like lisinopril are notorious for causing a persistent dry cough. The mechanism is well documented. These medications increase substances like bradykinin, which can irritate the airways and trigger a cough that does not respond to usual cough treatments. The National Kidney Foundation notes that around 10% of patients on ACE inhibitors report this side effect, while it is much less common with ARBs like Losartan. And here is why this matters more in older adults. A chronic cough steals sleep. Poor sleep worsens memory. Poor sleep worsens balance. Repeated coughing can trigger lightheadedness. And once again, a medication side effect gets translated into age. He's just more tired lately. She's just slowing down. No, sometimes the pill is talking. If you started Lisinopril and then developed a dry cough that would not quit, bring that up directly, not casually, directly. Say, could this be my ACE inhibitor? Because in many cases, switching to another class solves the problem. If you have lived through that cough, type cough in the comments. Number 4, the potassium and kidney problem you cannot feel until it is dangerous. This one concerns me deeply because it is often completely silent. No warning pain, no obvious swelling, no dramatic early symptom, just numbers drifting in the wrong direction while the patient feels mostly fine. Losartan and lisinopril can both raise potassium levels. They can also change kidney filtration, especially when dehydration, NSAIDs, or certain supplements are added to the picture. And older adults are more vulnerable for a simple reason. Kidney reserve is not what it used to be. Then you add a blood pressure medication, then maybe a water pill, then maybe ibuprofen for back pain, then maybe a potassium-containing salt substitute because someone is trying to eat healthier. That is how ordinary routines become dangerous combinations. High potassium can affect heart rhythm. Kidney function can worsen quietly. And too many patients do not find out until the blood test is already abnormal. This is why monitoring matters, not eventually, regularly. If you are on Losartan or lisinopril, you should know when your potassium and kidney function were last checked. If you do not know, that is your signal to ask. Use these exact words. When was my last potassium and kidney function test? And when is the next one due? If no one can answer clearly, there is a gap in your care. And if you have been taking one of these medications for a long time and nobody has talked to you about NSAIDs, dehydration, or potassium-containing supplements, that conversation is overdue. If that has never been explained to you, type never in the comments. Number 5, the blood pressure number that looks perfect and feels terrible. Martha Ellis is 76 years old, a retired teacher's aide from Harrisburg, Pennsylvania. Her seated blood pressure at the clinic was 118/68. Her doctor smiled every time. Excellent control. But Martha had started avoiding stairs. She stood up carefully. She paused before walking. Once in the grocery store, her vision dimmed for 2 seconds and she had to grab the cart. Then one morning, she got out of bed, took 3 steps, and collapsed. The emergency room did not call it aging. They called it orthostatic hypotension. That means the blood pressure drops when the person stands up. The American Academy of Family Physicians defines it as a drop of at least 20 points systolic or 10 points diastolic within 3 minutes of standing. Now listen carefully. A seated blood pressure can look excellent, while a standing blood pressure is unsafe. That is the trap. The chart says controlled. The body says unstable. This is one of the most dangerous mistakes in older adults on blood pressure medication because the consequences are not abstract. A fall is not a minor event at 76. A fall can mean a fractured wrist, a hip fracture, a hospital admission, loss of confidence, loss of mobility, loss of independence, all from a number that looked beautiful. If you are over 65 and you take any blood pressure medication, ask for your standing blood pressure to be checked, not just your seated pressure. Do not assume the lowest number is the best number. Sometimes the best number is the one that keeps you upright, clear-headed, and functioning. Number 6, the brain fog and memory slips that may not be aging at all. Ruth Delgado is 73, a retired bank teller from Albuquerque, New Mexico. She started telling her family the same story twice. She would walk into a room and forget why. She lost confidence in conversation because words took longer to come to her. She was frightened. Her daughter was frightened. Everyone started quietly thinking the same thing. Maybe this is the beginning of cognitive decline. But Ruth noticed something odd. The fog was worse at certain times of day, worse after her medication, worse when she stood up too fast, worse on hot days. That pattern matters. Now let me be careful here. Not every memory problem is caused by blood pressure medication, not even close. But medication must be ruled out before you casually blame aging, especially when the fog shows up alongside fatigue, dizziness, or lightheadedness. The brain depends on steady blood flow. If blood pressure is running too low for that individual, especially during posture changes, the result can look like mental slowing, poor concentration, and reduced confidence. In older adults, that gets mislabeled fast. He's forgetful. She's older. No, sometimes she is under-medicated for the life she wants to live, or over-medicated for the body she has now. If you or someone you love feels mentally duller, slower, or less steady after starting or increasing a blood pressure medication, put the timing on paper. Morning dose, noon energy, evening clarity, standing symptoms, near falls, patterns reveal what memory alone misses. And now I want to give you the most practical part of this entire conversation. I want you to bring 5 questions to your next appointment. Write these down. Question 1. Why am I on this specific medication and not another class? Question 2. What is my blood pressure when I am standing, not just sitting? Question 3. When were my potassium and kidney function last checked? Question 4. Is my current dose still appropriate for my age, symptoms, and other medications? Question 5. Could any symptom I am calling aging actually be related to this medication? Those 5 questions change the conversation. They move you from passive patient to informed participant. And any clinician who takes older adults seriously should welcome that. Let me come back to Evelyn Parker, the woman from the beginning. Her problem was not that she had blood pressure treatment. Her problem was that no one had reevaluated whether that treatment still fit the body she had now. Once the medication was adjusted, the fatigue eased, the dizziness improved, her confidence came back, her blood pressure stayed controlled, but more importantly, her life stopped shrinking. That is the point I want to leave you with. A blood pressure medication should protect your future without quietly stealing your present. If your numbers look good, but your balance is worse, your energy is gone, your thinking feels slower, or your body no longer feels like your own, do not let anyone end that conversation with the word aging. Ask better questions. Push for clearer answers, because the right treatment is not the one that creates the prettiest number on a chart. It is the one that helps you stay safe, clear, steady, and fully alive in your actual life. I'm Dr. Clara Hoffman. If this made you think differently about your medication, share it with someone who needs to hear it. And if you are taking Amlodipine, Losartan, or Lisinopril, tell me in the comments which one and whether anyone has ever really talked to you about how it makes you feel.